Hello, everybody. I am Michelle Barone with Moksha Grace Coaching, and welcome to Moment of Presence. I am joined again by Christa Barone, cancer survivor, operations consultant, and the daughter of a life coach. I had to add that. Today, we are talking about one of our favorite topics and one that has stuck with us for many, many years. Home is where your heart is. And if you struggle with a chronic illness, frequent doctor visits, hospital stays as a patient or as a caregiver, then our hope today is that the conversation is going to help you make those experiences better or give you a different perspective even. So, it's going to include personal choices about healthcare, mindset, and how the right formula of all three can really make a difference and change everything. So we are glad you were here. And as a matter of fact, if you know someone that needs to join this conversation that could use this conversation and be part of it, please take a moment, like right now, and go share the video with them, share the link and ask them to join. Because this is really important that we get the word out about being a patient, being a caregiver, and how to do it the right way. Right, Christa? Yes, maybe.
Yes, absolutely. Sorry, I was muted.
So please make sure that you subscribe and like this video, and also make sure that you are part of the free Facebook group, Calm the Chaos, because like we did last week, we are going to go live over there for the after chat. Where you can ask questions, make comments, get some more detailed information. If something really
Chat with guests.
What?
Chat with guests.
Chat with guests, an even bigger and more important reason to join us over there. So yeah, we're gonna have a lot of fun over there after the chat. So for those of you who don't know, I am Michelle Barone, Christa Barone's mother, and I am a certified life coach that specializes in emotional intelligence and life transitions. So kids go off to school and you don't know what to do with yourself. You have maybe there's been a breakup and you're not sure how to handle it, but any kind of life transitions, that's what I help my clients work through. I coach clients that are ready and willing to acknowledge, identify, and disarm their triggers. My mouth is getting all mixed up. Learn to manage their emotions and respond to situations. So my clients will come back and say that, or even in the middle of our time together, how they have better, stronger, and more stable relationships. They have a better relationship with themselves and other people. They have better outcomes, better careers, are less stressed. So a lot of the techniques that we talk about are able to inspire and facilitate change. So if that's what you are looking for, then you should definitely follow along and join us because we have a lot to talk about. So as we do every week, let's do our breath work. So Christa, you'll join me?
Sure will.
All right. So we're going to take 3 deep breaths in. We're going to hold it for 3 seconds. We're going to exhale. And then we're going to hold it for 3 more seconds. And then we're going to take another deep breath in. Okay? So 3 rounds. Ready? Deep breath in. Hold it. 3, 2, 1. Exhale. Hold it. 3, 2, 1. Inhale. Hold it. Exhale. Hold it again. 3, 2, 1. Last time. Inhale. 3, 2, 1. Exhale. 3, 2, 1. It always makes me feel so calm and centered. How about you?
Absolutely. It's taking a moment of presence.
I love when you join us.
Oh, thanks.
So let's dive in.
Yes.
Home is where your heart is.
Sure is.
Do you remember the first time you heard me use that statement? Do you remember?
I don't know why. The only thing that's playing in my head right now is Dreams Are a Wish Your Heart Makes, because I feel like it's the same tempo.
Yes.
So I was about to say I thought it was part of a song, but that's not right. So I'm going to have to say I don't.
So when you were in the hospital,
Mm-hmm.
we would, you were 3, so you don't remember a ton, except you would jump in the car before I could get in the car. We would bring everything to the hospital that you could possibly need. Your comforter, your pillow, decorations for the wall. We use that big cart that most people use for leaving the hospital, the discharge cart. We would use that going in. Like, they would just know to have it downstairs waiting for us, because that's how much stuff we would bring in. And the reason why is because, and I had everybody vote in our free Facebook group, which, by the way, join us because we're going to have an after chat after this, in the Calm the Chaos group. I responded to the situation versus reacting.
Yeah.
I took a moment and thought, what would be best for my daughter? What would help her make this easier? And so, you had chores. You had to set the table for dinner. We would have dinner every night, because home is where your heart is. And my daughter, was laying in the hospital bed. So that's where that came from.
I love it.
So the other part of the talk today is your health, your mindset, and healthcare are all connected. Why do you think these 3 things are important, and how do they fit together for you?
Well, I mean, I think, honestly, at this point, I feel like you have to kind of be living under a rock to never have heard about the scientific studies that are coming out that are showing, even like placebo effect is a great example of that. That mindset is so crucial to the healing process.
Right.
And, going back to the topic that today, home is where the heart is. When we're home, we're comfortable, we're in the zone, we're in a great mindset usually. Especially in chronic illness situations, to lose that long term creates a lot of mental turmoil and can really affect your mindset. So creating an environment around you that's conducive to healing makes a world of difference. Yeah. And especially in my case, I was a child at the time. Children don't fully understand what's going on. So all of a sudden, what they know is, well, now I'm in this completely new environment, surrounded by all these different people. I don't know who they are. They're speaking with words that I don't even understand. They're poking me and prodding me and hooking me up to things. And there's all these things that are happening. Any way that you can create comfort, do that. Because mindset is going to be what makes or breaks the situation, essentially.
Yeah.
Modern medicine is phenomenal, but we should maybe take a look at some of the roots of medicine, because I think we'll find some interesting things.
Yeah, I agree with you. And I think that, a lot of times, and especially because of, the craziness of the world that everybody just went through, a lot of policy rules were brought back to the forefront that,
I think you mean they were thrown back 20 years time.
Yeah. Before my beloved patient and family-centered care philosophy that I was handed or asked to take over for the healthcare system. Yeah, providers need a class on bedside manner. Yeah, I absolutely agree with you. And funny that, back in the day, we actually did that. We would have classes for the providers, the professional caregivers, that was from the other side of the bed. So
I mean, you used to do trainings on every single person that was going to start working at a specific medical facility had to go through a training of which an entire segment was devoted to patient and family-centered care.
Yeah. And that said a lot for the healthcare system. And there's a lot of healthcare systems nowadays that went that route. But I do think that because of what has happened, there's been some words that talk about triggers, like we can't allow that to happen, or policies, HIPAA, my favorite. So this kind of leads into the discussion of, should caring be different between chronic illnesses versus acute situations? And so, what's your take on that?
Do I think it should be different? Absolutely not. Do I think that it is? 100%. And you and I kind of chatted about this offline before we jumped on here. But I've been in both situations, and while I don't remember everything from being 3, I do remember a lot, which is usually very surprising to people, but there's even scientific reasons for that too. But there's, I had a knee surgery the year I graduated college, which I think is almost 10 years ago now. Oh my God. I was basically an adult at that point, but I was lucky enough to have my procedure done at a children's hospital, because orthopedics like to work on their work and they don't like to whatever. So anyway, the bedside manner was completely different than I can remember being longer term. That was a completely outpatient procedure, but I've also had inpatient procedures on my legs where I've stayed in the hospital for 2-3 days a week, whatever it was. And it's completely different. Completely different.
Yeah. And, what I noticed as far as the acute versus the chronic is, there's a different, because I've been on both sides, right? I was the mom, but I was also the professional in the healthcare system. And so when the patients come in, even adults, when you come in and you're like in the emergency department because of something and you've never needed healthcare before, you're scared. And you are a kid again. I don't care how old you are, you're a kid again. When you're sick and you're stuck in a hospital and you're told to lay in that bed and not get up, you're a kid again and you're scared.
Yeah.
And who's there to advocate for you? And that's why that's why I always advocated for families to be at bedside. And it's a safer environment, right? Because you have someone there telling them, sharing with them what you may not be able to remember or communicate at that point, depending on the situation.
I know for me, if I go to a basic general like primary doctor's appointment, I'm blacking out the minute that appointment starts, and I'm gonna hope that I remember afterwards, but cross our fingers. But before we go on to the next topic, I do want to talk about this a little bit more because I hate to shatter the illusion for people, but we all want to believe that healthcare providers got into the field and are in the field because they're only there to help others. And that's true in a lot of cases, but just like any other business that's making money, they have to have KPIs, key performance indicators. They have to have different numbers that they look at. And so when you're dealing with acute situations, an outpatient surgery, maybe a quick procedure, some type of, MRI, ultrasound, whatever it might be, versus a chronic illness like cancer or an immune deficiency disorder, whatever that might be, where you're there for a much longer time. The KPIs, the parameters that they're checking on are very different. In your acute cases, they're looking at how quick can we get people checked in? How quick can we get their procedure done? How quick can we get them checked out? And that does affect the bedside manner.
Yeah.
For chronic cases, it's a much different set of numbers that you're looking at. And not only that, but both parties are aware that I'm going to have to see these people over and over again. So
Right.
I need to be in a completely different mindset than someone in an acute case like an outpatient OR. An outpatient just means like you're in and out, just for those that aren't familiar. It's a completely different mindset because you're thinking, I want to care for this person, but how can I do it as quickly as possible so I can free this bed up for the next person? And so I think that's where some of the bedside manner gets lost, and even more of a reason why, as much as you can have someone there for you, whether it's your parent, your sibling, your friend, someone there that can be with you, who can be that voice of reason.
Yeah.
We talked about before we jumped on here, when I had my outpatient knee procedure.
Yes.
I was
horrified
at the bedside manner because they weren't listening to me. I couldn't bend my leg, and this nurse is trying to like scoot me off the bed and just let go of my leg. And I'm like screaming in pain, hello, I can't bend my leg. And so they wouldn't listen to me. But when you stepped in,
oh yeah,
now they're listening. So it's always nice. And you don't have to be, it's not saying we're nasty about it or anything like that. But when you're coming off of anesthetics and stuff like that, you're not in your right mindset.
Right.
And it's harder for you to advocate for yourself when you're in that space.
Well, and it's safer, right? It's safer care. I remember my mother, your grandmother, Yaya, she, after her surgery, she was laying there, and I, was supposed to only be allowed to come in, and I worked there, for, short time periods and then leave again. I remember walking in and listen, I respect healthcare workers. I love their choices. It's an amazing profession to go into, but it has lost the compassion. It's been taken away from the healthcare providers because they have had to, like you said, meet the KPIs, meet the numbers, work towards a survey, kind of like the kids today with, being taught to a test, but that's a different conversation. But I remember walking in there, and this nurse had so many patients that she was trying to help recover that she didn't notice my mother was bleeding all over the place. That was not supposed to be happening. And that was very scary. And there were other situations, with her where I would walk in and find a situation. One time she landed up in the ICU. So it is scary. And the more you can have somebody with you, just to be another set of another pair of eyes. And I remember saying that to the nurses and to the doctors, like, I want to stay here, not because I want to watch what you're doing to make sure you're doing right or wrong. Like you said, you're human. There's going to be things that you may not catch.
Absolutely. And honestly, this is where, going back to your health, your mindset in healthcare, this is where the mindset of healthcare practitioners come into play. Because what I've seen is there can be such an ego attached to it, which is probably due to compassion fatigue, as I've heard it called. And I think I mentioned this the last time I was on, was I went in for a procedure as an adult. That was an experience. And I asked the anesthesiologist, what are you about to do? Don't worry about it. Inject it into my IV. I'm sorry. What? That's not how that's supposed to work. I'm literally going under for a procedure. Now is not the time to be funny.
Yeah.
And so there was an ego in him of, I'm the professional. She doesn't need to know what's happening. She's going to be knocked out in a second. I don't need to tell her. Or, there was a procedure I had back in the day where they forgot to turn the machine back on. Hey, are you sure this is working right? Because the things look a little funky. No, it's fine. It's fine. Again, ego coming into the situation. I know better because I went to school for it. You do know a lot more but
Yes.
you do not have the intuition of a mother, of a father, of a best friend, of someone connected to the patient.
Right.
You may make a lot of amazing and wonderful and life-altering decisions, but you cannot discredit the internal guidance that someone is tuned into because yours is turned off and because
Right.
you're not tuned into yours.
Yeah.
And that's something I think that is not talked about in healthcare at all. They don't necessarily teach how to tune into your intuition, because
Right.
that's where you're going to catch those mistakes before they happen.
Right. And I think, and we have a couple healthcare professionals on with us, which I'm so excited about. So thank you. And I agree. This could be a very lengthy discussion. We could probably have like a whole conference on this. Oh, wait, I used to. But anyway, yeah, there, well, to Allied's point about the opiate issue and in the emergency room and, drug seekers versus people that are in pain, that is a hot topic for me because I've been on both sides. I've been there advocating for the patients that have sickle cell that know exactly what their cocktail needs to be in order to get a hold of their pain. And it's not just sickle cell patients, it's chronic
pain.
Right, chronic pain, like my
Absolutely.
mother, whose scoliosis is never going to go away, and they have no way to fix it. And so there's that whole issue. But then I've been on the other side and watched people that have come in and they have been drug seekers and needed to go in for recovery. So
here's where intuition could play a valuable role if people were tapped into it.
Exactly. And like you said, taking the ego out of it.
Right.
And not saying, well, I'm right, or the healthcare system's right, or my favorite, but it's policy.
Yeah, I was just
not
about
our
to say.
policy. It is our policy. And it's like, no, every case is different. And you need to be able to like take a step back, evaluate the situation. And I used to train for this. I used to train, the healthcare providers on this. Take a moment and assess the situation.
Right.
Because it's not all the same.
No.
And Raymond, to your point, yeah, when you're working with those patients, sometimes they do just need someone to sit down with them, a touch point. Maybe they haven't felt another, human touch, like someone to just hold their hand and let them know that it's been okay. And it's just so important.
Yeah.
And yeah, it's
we've said some negative stories, but I do want to throw in a really positive one of what could be.
Yes.
That was what you just said about needing just like a friendly face or a hand touch, whatever it is. I can very distinctly remember when I was younger, I'd have to go for follow-up appointments, go to the doctor's office, the oncology office, which basically just means cancer office. And I had a port, so I had to get medications or flushing, whatever done. And I was always adamant that you had to be there with me. I don't remember how old I was. I have to assume 4 or 5. And I distinctly remember that I felt so comfortable and so safe with those healthcare providers that you were talking to the doctor in another room. And I said to my nurse, you know what? Let's go flush my port really quickly, and I want to surprise my mom. And we went into the room, and she flushed my port. I was a tough little girl. I got it done. And you came out and said, okay, are you ready to, get your port flushed? And I went, I did it already. Because I felt so safe and comfortable with those nurses.
Yeah.
Why is that not everywhere, in every situation? And I'm sure it was because those nurses, every time you looked at them, you were around them, you could feel. I'm literally getting chills right now, putting myself back in that spot.
Yeah.
You could feel the absolute just love and compassion and admiration. And it was just such an unbelievably positive experience and environment.
Yeah.
That is the recipe to healing. And that's the environment that we created in my hospital room. Right. And that's where mindset ties back in. That's where home is where the heart is. I felt at home.
Right.
And that in turn created a mindset that made me a warrior
Mm-hmm.
to be able to get through what I did.
Hallelujah.
And still to this day.
Right. And if you remember, a lot of those healthcare providers we're still friends with.
Absolutely.
We used to, we celebrated Christmas together. We celebrated Thanksgiving. We celebrated New Year's. Whenever anyone brought food, it was always like, the open house was our room.
10, 15 years later, they would notice me from across the freaking cafeteria and run over to say hi to me because they knew me.
Right.
Yeah.
And yes, it was 1998, people. So it was quite a while ago.
That shouldn't matter.
No, it shouldn't matter. It shouldn't matter.
Except
what's changed is that there's been more regulation, I feel, on the healthcare providers of what they're allowed to do and what they're not allowed to do. For God's sakes, I remember trying to sneak water to the nurses because they weren't allowed to have drinks at the desk. And it's like, they're writing notes. Why can't, but oh no. And yes, we know why. It's a certain jack-o'-lantern cauldron, we'll just say. The first initials. You remember? They used to come in and do surveys at the hospital.
Yes. Yeah. Light turned on, it clicked.
Yeah. So, so these regulations were put in place, and yes, it's for safety. Yes, it's for, making sure everything is sanitary and all of that.
Well, let's be real.
But we're forgetting their people.
Well, but let's be real. It's not about sanitation. It's not about safety. Those are all the positive reasons why. The real reason is fear. Fear of being sued. Fear of making a mistake. Fear of somebody slipping and not doing the right thing, because healthcare workers are incredibly overworked. Right. They're forced to work these incredibly long hours, be short-staffed. They are completely burnt out. Mm-hmm. But our society has created such a degree of fear in everything, right, that everyone is scared to be compassionate. They're scared that they're going to accidentally say the wrong thing or do the wrong thing. And so when you have fear and you're pushing fear and you're creating fear, well, now you're manifesting issues. Now you're manifesting problems. And so it all comes back to mindset.
Right. Right.
If your mindset is that you are an incredible healthcare provider, that everything goes your way, that your patients are happy, that you have a great relationship with your patients, that you go into work with your mindset solid, mm-hmm, because you have a great coach.
Yeah.
Maybe it's because you're doing the work.
Maybe.
Either way, that sets you up to take care of your patients better. Mm-hmm. And as patients, if I don't remember ever in any of my healthcare, even in therapy, I will say, because yes, I've had therapy, big surprise. At no point, maybe in therapy a little bit, but mindset and the techniques that I could do myself are not really talked about.
No, right. Because what about helping a patient relax before the pain medication kicks in, and
instead
helping
of holding the child down, have them take a few deep breaths first.
Or explain what you're doing, whether you're a kid or an adult. Mm-hmm. But I wanted to respond to Allied's comment, because I want to tell a quick story, because this is, and it's true, there's a lot of violence with healthcare workers. And so there was a situation like within the first, 6 months to a year when I was working at the hospital, and there was this dad, and his daughter was in ICU. She was very, very sick. And it was a teenager. It was a teenage daughter. Not that makes any difference. It was a still very serious situation. And I'm the family advocate, and they call me. They like page me, and they're like, "We need your help. We have a difficult family member." And we know that word was another trigger, and my tics would come out. And so I got there, and I was like, okay, give me the details about this dad. And they're like, "Oh, he's being so rude and he's just this and he's that and he's argumentative and he won't leave the bedside, and just going off, telling me all these horrible things. And they go, and when you go in there, get ready to duck because he might just punch you. And I was like, oh, okay, sure. So this is my job. I have to go do this. So I walked in and I met him, and they're all, oh, they sent you in? You're not big enough to take me down, because I'm 4'11" and a half, if you don't know me. And I just said, what's going on? Like, but, I'm here for you. I'm the advocate. What can I do for you? And he just told me what was going on with his daughter. We talked about football for a few minutes, which opened up, he started building rapport with me. And then he told me how scared he was about losing his daughter, and how scared he was about, something going wrong. And he wanted to understand what he could do better when he brought her home, because she was a chronically ill patient and he thought he made a mistake. And so there was all of this stuff going on behind the scenes. No one took the time to ask.
Yeah.
And so he was I used to call them difficult for me, meaning the one person may say, Michelle, go see this patient. He's being difficult for me, but he's not difficult for me, because I just went in and they, when I walked out, they all, like, their jaws were on the ground and they were like, how did you do that? And I was like, I treated him like a human being and asked him what was going on and helped me understand, like, what the tension was.
So again, fear.
Right. And there were so many situations like that. And, our healthcare system used to teach us about always keeping your back to the door. You always want to make sure you have an exit plan. And, we're learning that in a group project we're doing. But a situation with, there was a patient, an adult, yet he had cerebral palsy. And so in his mind, he was maybe 5. And if he was approached and just started being poked and prodded, like you talked about earlier, it would get to the point where they might need security to come in, because he would get furious. And he was a big kid. He worked out. He had muscles. And so what happened was, we established a routine that was put in the computer, that before you approached him, like, red flags, these are the things that you must do before you work with this patient. And it worked. And security didn't have to be called. And he didn't have to be afraid. And his mother didn't have to be on edge every time she brought him in.
Yeah.
So I think that it's, it's personal choices. It's responding in a situation and treating the people with dignity and respect.
Yeah.
Need to be near. These sound familiar. Partnering.
Taking care of your mindset, no matter what side of it you're on, patient, caregiver, or healthcare provider.
Right.
Which, Michelle, how would they take care of their mindset?
That's
whether
a
past
great
or present stuff to work through.
So coaching is a great option. There's always therapy. Coaching is a great option. Really taking the time to not hash out the past, because it's not about that. That's not what coaching is. That's therapy. And if you want to do therapy, that's cool. I am not a therapist. Coaching is more about looking forward, looking at what did the past teach you? And then how can I apply those lessons without the emotional triggers to them? And so that's how we move forward. That's how we move through situations. We don't swallow down our feelings. We embrace them. We welcome them in, as a matter of fact. And we look at them more like warning signs. So it's wonderful when you get the help that you need. And if you're ready to book a chat, please do that. I would love to have that conversation with you. We're obviously gonna have to have a continued conversation about this
absolutely.
because we didn't even get past like the first page of our notes.
Absolutely.
So,
and I do want to add real quick about coaching. As someone who's had a lot of medical trauma in her life, I will tell you that there is a big difference between therapy and coaching. And if you've tried therapy before and it's not really your jam, or maybe you're in it, but you're not really seeing a whole lot of progress, it may be worth it to look into coaching, because I personally have found that I've had so much more progress through coaching than with therapy. Therapy did what it needed to do at the time when I was in it, but no trauma. I shouldn't say no trauma. It would be very rare if you have too much trauma for coaching to be helpful, or if you have too little trauma for coaching to be helpful. Coaching is helpful no matter what stage you're in, and it's not something to be intimidated by. You don't have to be this like super, I don't even know what type of person to say you have a coach. It just means that you're working on yourself.
yeah.
And you're going to see a lot of progress really quickly, because I know I did. And as someone who is as neurotic as I am can see progress, you certainly can too.
Well, I am so glad that you joined me. You're coming over to After Chat with me.
Yes, and we need to work over there like ASAP.
Yes. So join Calm the Chaos if you aren't already, and we will see you over there. We're going to continue our chat over there, and we'll talk to you next time. Bye for now.
Bye.